Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei-Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs and Beachside Roofing.
Aloha, happy Monday morning to all of you. I'm Yanji Denise, joined by Ryan Kalei-Suji. This, of course, is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. Thank you for joining us. We see a lot of you joining us live right now. And of course, we've got a lot to talk about, Ryan. And today we go straight to the top at the Hawaii State Capitol.
That's right. Joining us once again is Governor David Ige. Good morning, Governor. Thanks so much for being a part of our conversation this morning and for joining us. We have a lot of topics and a lot of things that we want to get to, so we're going to jump right in. First, starting off with COVID-19 and where we're at as a state. Another day where we're seeing four-digit case counts, and we continue to see this Omicron variant spreading throughout the community on various islands. If you can update us on the conversations you've had with the mayors, and what are your thoughts right now of where we're at right now as a state with COVID-19?
Brian, we are definitely concerned as the case counts have increased, and we're now averaging 7-day average is more than 3,000 cases a day. We are carefully watching the healthcare system and the hospital counts, and it has been steadily increasing. The one area that has had a slow increase is really in the ICU units with COVID patients. And, we had heard that Omicron might be not as virulent as Delta or previous COVID cases. And certainly that's something that we are looking at. Ryan, as you know, Omicron and COVID has really spiked all across the country. Virtually every state and every community is seeing their highest record cases, and they are definitely challenging healthcare systems all across the country, and certainly that's a concern for all of us here.
And to that end, what kind of measures are you looking at putting in place to make sure that our healthcare system can sustain the surge that we're seeing now? Of course, we know there can be a delay between these high case counts and when we actually see impacts to our hospital system.
Yeah, certainly, Yanji. We have been working with the hospitals, and they've implemented once again their surge planning as they are expanding beds and other activities. Queens Hospital, for example, did re-erect the tent outside of the emergency room, and we are seeing all across the state the hospitals are preparing. We are working with FEMA to get additional staffing for our healthcare system, and we did the same thing during the last Delta surge. We do know that it's an area of concern. We are implementing the change in CDC policy regarding isolation, and as has occurred all across the country, Omicron is more easily spread, and it has had an impact on workforce for first responders, teachers, as well as others. And so that definitely is a current concern here in the islands, as it has been all across the country.
When we began to see the case numbers going down and the vaccination numbers going up, this is prior, of course, to Omicron, you had given the authority back into the counties, allowing the mayors to really have control over what decisions they wanted to make if there were some sort of surges, or to really decide if they wanted to put in further restrictions if needed. Since then, of course, we know where we're at with Omicron and with these case counts. Do you feel comfortable still with allowing the mayors to make these decisions for their communities, or do you see a time where you would eventually need to step back in like you did prior to, with the first wave of COVID-19, and having the mayors come to you for approval of their regulations moving forward?
Ryan, we continue to talk on a weekly basis, multiple times a week. And so We have been having discussions about restrictions and actions that can be taken. This is a very different surge once again, and there is no playbook. And so, I do respect the mayor's abilities to make decisions. They continue to look at the situation in each of their counties and are taking appropriate actions that they feel is necessary.
I want to ask you about testing. There's a lot of people who say that the testing is just not available. The state, of course, did distribute a lot of home tests a couple of months ago, but people have burned through a lot of those. And when it comes to getting a PCR test, we see that those are not as readily available as folks would like. Is there any plan to expand access to testing?
Yunji, we have been working to expand access to testing. Part of the challenge, I think, is that the people who are doing vaccinations are the same who are doing the testing. And so we are working with the providers, the pharmacies, and healthcare people all across the state to try to encourage them to have available both vaccinations as well as tests at every site. If someone is trying to get tested, I certainly would go to the county website. One of the challenges when we have, several hundred testing and vaccination locations is really some of them may get full and run out of tests, and there still would be tests available in other areas. And so I certainly, if someone is in need of getting tested, I certainly would encourage them to, if their first choice site is not taking appointments, to really look at neighboring pharmacies. Because I do know that there is broadly testing available. We have been seeking the rapid antigen test, and since early October, moving into November, we've been trying to get a commitment to purchase large quantities of these tests, and we just have not been able to do it. We can't find a vendor who wants to sell it to us. The federal government is buying, and we have been outbid in seeking tests by other states and other entities. So that is a challenge, but we've significantly increased the volume of tests that we can do locally. And certainly if someone needs a test, I would just encourage them, if their first choice location is not taking an appointment, I would look at other surrounding pharmacies as well.
On this topic of tests, we're seeing a lot of questions also about the Safe Travels program. We had also heard talks that there was maybe a consideration of adding the testing requirement back into the Safe Travels program, which would go along with the vaccine verification that is currently required for those who want to bypass quarantine. Has there been any discussions to change Safe Travels program to include this testing option, or any other changes that might be coming for those residents and visitors entering the state?
Yeah, Ryan, we definitely are looking at the change in CDC guidance and looking at what is required to implement it. As you know, the CDC did change the requirement. Instead of a 10-day quarantine, they did change it to a 5-day quarantine with 5 days of wearing masks. So we are looking at that and making those changes. We also are looking at the boosters and what CDC is now saying is about up-to-date vaccinations, that we want to see a booster shot for those who are fully vaccinated within 5 or 6 months of completing their vaccination regimen. And we are looking to see what actions are necessary to implement that in Safe Travels.
How soon could we see a change like that, the booster requirement?
Something like that, Yunji, we know that the community needs time to react to that. So we would have to provide at least 2 weeks for those who may not be up to date to have the opportunity to go and get vaccinated if they need to. So any kind of change would provide at least 2 weeks of notice to the community in general.
Something else that happened over the weekend is we saw the return of a cruise ship here to the islands, and there were a lot of questions and comments about the cruise ship coming into dock here in our comment section this morning. I think a lot of people out there are, they recognize and they remember back when this all started. It all really started with those cruise ships getting infected with passengers and being docked in Honolulu Harbor for some time. If you can talk to us about what that conversation is like with these cruise liners who are entering back in and how they are, essentially promising that they are taking every step possible to ensure the safety of the passengers, as well as when they come off to their exposure to those who are here on the island.
Yeah, Ryan, thanks for that question. It definitely is an entirely different situation that we're in. The CDC did issue very strict guidance to the cruise industry about what would be required to keep both the crew and customers safe on cruise ships. So, for example, the cruise lines do have the option at looking at requiring vaccinations, and some of them are requiring 100% vaccinations, meaning all crew and passengers are fully vaccinated. And others are looking at lower requirements for vaccination. I think the real difference is the cruises that are focused on children who don't have the ability or are not eligible for vaccinations, and how many of the customers would be children who would not be eligible for vaccination. Both Carnival and Norwegian cruise lines, Norwegian is focused at virtually 100% vaccination rates for crew and passengers, and Carnival is above 95%. I think the Grand Princess is at 99%. So the CDC is requiring reporting on that status for all the incoming. The cruise ships have to have the ability to isolate and quarantine on board the vessels. And so anyone who is COVID positive would have to be able to be isolated on the vessels themselves. And our agreement does require the cruise line to have an arrangement. If someone is COVID positive and needs to disembark from the cruise liner, the cruise company is required to be able to provide transport for those COVID positive patients. They need to have arrangements with a healthcare provider so that they can be transported safely to a healthcare provider, and they need to take care of those who are COVID positive. They also need to have the ability to test on the cruise ships themselves. And so should someone become symptomatic, then they have to get tested. And certainly no one who is COVID positive are allowed to disembark without approval.
I want to ask you about masks. You've been a big proponent of masks from the beginning, the only state to continue with an indoor mask mandate throughout the pandemic. There's a question here from Kara that I've been hearing a lot, which is, why are we not providing students, school staff, and community with high quality masks, or is there a plan to do so? Some municipalities on the mainland have given students and teachers KN95 masks. I know me personally, when I went online to try to get some of these for my family, they are quite expensive. And if you can even authenticate whether or not they're the real deal, there's reporting that a lot of them, that if you try to buy them online, might be fakes. So is there any plan to try to distribute high quality masks to the community on a large scale?
Yanji, as you may recall, we did during the early stages of the pandemic purchase and distribute high quality masks to preschool providers, to businesses who have been unable to get masks. We are having that conversation, especially with the Department of Education, to make sure that they have access to the masks that they need. We did have a warehouse full of personal protective equipment, and we definitely are working with the Department of Education to make sure that they have the equipment that they need to keep their employees safe and the students safe. So we have not purchased child-sized masks previously, and certainly that's something that we could consider doing as we look forward to what's the best way to keep our kids in in-person learning.
You know, when we look at some of the cluster reports that are coming out and where a lot of these community spreads or super spreaders are happening, they're happening from these events, events that do require vaccination verification under programs like the Safe Access Oahu program that has been established. But given what we know about Omicron and its ability to spread even to those who are vaccinated, there are some who are questioning if this vaccine verification type of program is effective enough with Omicron, being that it is still spreading between those who are even vaccinated, some even boosted, are still becoming infected, and saying that because of the spread, verifying if someone is vaccinated some may not be enough. There may need to be also testing available for these types of events. I want to get your thoughts on that, of course, because we know the language and the narrative now is getting vaccinated will, and if you get COVID, can really help to reduce your symptoms and really keep you out of the hospital. But in terms of spread overall, do you believe that these vaccine verification programs are something that is still helping during a time when Omicron is spreading, regardless of vaccination status?
Yeah, thanks, Ryan. I mean, we definitely believe that the program is helpful, but we know that being just fully vaccinated and not boosted is not as much protection as the vaccinations did provide during the Delta surge or previous COVID viruses. So we continue to encourage everyone who is fully vaccinated to get boosted. We are having discussions with the mayor about changing the Safe Oahu Access program on Oahu as well as across the state to require up-to-date vaccinations. And, the CDC has been talking more about that, about its making sure that you're within 6 months of being fully vaccinated and getting another shot for those who are outside of that window. Again, Ryan, it's about personal responsibility. Certainly, I would encourage people to make choices about going to events that have large gatherings and begin to ask whether they know whether people are infected or not. I certainly would recommend that people avoid large gatherings, even those where everyone is supposed to be vaccinated. I certainly would encourage everybody to wear a mask and even double masks. Just talking with Dr. Char, she's expressed to me and taught me about what's required to wear 2 masks, having one be a medical mask, not necessarily an N95, but then at least a surgical mask, which provides improved protection, and then a cloth mask over that.
We're getting still a lot of questions about sort of what can the hospitals take. This one from David kind of sums it up. What is the max number of COVID hospitalizations before the system cannot handle anymore? We know that during the Delta surge, we got over 400, and that, there was really talk of a breaking point of the whole system collapsing. We're not there yet, but when you look at, this is also going back to Ryan's question, this idea of taking back some of the controls, if you will. We've heard a lot about personal responsibility, but at some point there is a feeling that perhaps government needs to set more guardrails. What's your threshold for this? If it's not case counts and it is hospitalizations, at what point and what would you look at actually implementing to try to make sure that our hospitals can handle the surge?
Yeah, thanks, Yanji. As we've had discussions before, and I know you've asked what is the threshold, unfortunately, there is no simple threshold. Would I be willing to step in and issue a statewide order? I absolutely would be. If I do believe that that's the best way to continue to keep our community healthy and safe. I think the challenge with hospitalizations and monitoring hospitalizations is the fact that it's a lagging indicator. The case counts that we see today, the 3,000 plus cases that were part of the count today, really will have an impact on hospitalizations 5 to 10 days from now. So we are looking at a couple other things. We are looking at the number of COVID patients in the ICUs, because that really is an indication of severe illness. And with Omicron, we're seeing less COVID patients in our ICU units, even though that is increasing very, very slowly. We also are monitoring oxygen utilization. As you may recall, we did have a period of time where during the Delta surge, our hospitals were challenged with availability of oxygen. And that's an indication of the severity of the illness and those that are really on ventilators and need help breathing. At this point, during this latest surge, we have not seen a real significant increase in oxygen consumption. So, the indications are that Omicron is not as severe an illness, and we don't have as many patients going to the hospital ending up in the ICUs or on a ventilator.
We could spend this whole half hour or even more talking about COVID-19, but there are so many other issues that we also want to address. And before we let you go, we want to bring up a few of them. One of them being Red Hill. If you can provide us an update on what's happening there. We know your stance on this. You have come out, forcefully and asked for the protection of these aquifers and for the military to stop, of course, the fuel tanks and to withdraw from that. Can you tell us where things are at in those conversations with the Navy and any other updates you can provide us on what's happening with Red Hill?
Yeah, certainly the Navy has been working toward complying with the state's order. I know that they're in the process of hiring an independent consultant, and they have asked us, they've in an RFP process, they've gotten several companies or consultants who have responded to help assess the Red Hill tanks. And so we continue to make progress in that area. As you know, the Navy has been flushing the distribution system in their military housing to try to restore the water quality. And we continue to work with the Navy in doing that. They've committed to paying for water testing equipment at the university. And so we want to be able to test the water locally so that we can reduce the time in getting lab results back. And so we are making progress, Ryan. Certainly, we continue to look at the fuel in the Red Hill pumping station itself. And the Navy has been working to skim the fuel out of the Red Hill shaft. And we continue to work with them to try to identify the source of contamination and what's required really to ensure that fuel does not get into our aquifer and into our water system.
Yeah, and on that point, Ernie Lau on this program has said that the 3 wells that are shut down right now preventatively to make sure that that doesn't contaminate our system could be shut down indefinitely. What are your concerns long term for our water resource, given that those wells are not operable at this moment?
Yanji, I think the real concern at this point is really trying to understand the source of the contamination and really remediate it. If we identify that a fuel head spill and we get a better understanding of how it's getting into that Red Hill well, that will at least let us develop plans to remediate. That might require removing soil from areas of contamination or shutting down that well and really looking to establish other wells in different parts of the aquifer. We continue to work with the Navy to be able to identify the source of contamination. And I think most importantly, how do we correct that and take the actions necessary to assure that it doesn't happen again?
We know that you're preparing for your final State of the State address that you'll be giving to the legislature in just a little bit, but wanted to get your thoughts heading into this legislative session with the budget that you proposed to the legislature. There have been some new projections on the tax income that will be coming in for the state, as well as your decision to put aside close to $1 billion for the rainy day fund. We spoke to both the Speaker and Senate President, who say they would probably like to spend that money instead rather than put it away in a rainy day fund. Your thoughts about the budget and overall going into your final state of the state?
Yeah, just a couple things, Ryan. I really want to make sure that we can, we worked really hard. My administration has really worked hard to put the state on sound financial footing. COVID upset that plan, and for the first time in the state's history, we had to borrow money to make payroll. Our commitment to $1 billion contribution to the rainy day fund is really to ensure that we don't have to do that again. We understand better about how and what level of disruption to our economy would be impactful. And I think that restoring the rainy day fund to a sufficient reserve would really be an investment in our community going forward. We do know that after all the federal support that has been provided over the last 2 years, the federal government will not be in a position to step in again should there be another emergency. And if we don't restore our rainy day fund, then again, we will really have a difficult time, have to look at furloughs and layoffs again, which we know is really hard because during these emergencies, the public needs more support. They need healthcare, they need food stamps, they need unemployment benefits in order to survive. And we want to make sure that the state is in position to be able to provide that.
I just want to give you an opportunity to give us a final thought this morning. I think there's a lot of uncertainty in the community when it comes to COVID. Parents sending their kids back. I know a lot of them have gotten notifications of possible exposures. We see, labor shortages throughout because people are calling out sick or because of exposures. And there is this real feeling of, when is this going to end? Obviously, I know you don't necessarily know that, but what is your message to people who are feeling so much anxiety right now regarding COVID and sort of the state of where things are at, especially if, they might be having a hard time getting a test and they might not be able to get the masks that they need? What is your message to the community this morning?
Yeah, certainly. Thanks, Yunji. I do know that this is a challenging time for all of us. I've had to deal with being exposed to the virus and trying to find lungs to purchase masks for myself and my family. I've had to go and look at where we can get a test so that we can just feel a little more comfortable about the fact that even though we've been exposed, we're not carrying the virus. So I do appreciate and understand what our community is going through. I just want to assure everybody that we are working, that we have a significantly increased capacity to test, to find and identify those who are infected with the virus. So as I said, if where you usually go to doesn't have an appointment, I certainly would look at nearby pharmacies and other health locations who should be able to test you if you need to get tested. I encourage everybody to get boosted. It's the best way to protect yourself and protect your loved ones from getting infected with COVID and really ensuring that you avoid serious illness and death ultimately. And so I do think that we're in a much better
And I think we might have lost him there. But to sum up what the governor was saying, he said that he understands that people are feeling a lot of anxiety right now, that they are expanding testing capacity. I've heard anecdotally from friends that they've had a lot of hard time getting a test, especially those PCR tests. The governor says that they should be available. If they are not available, at your provider of choice, to look on the county websites and make sure that you expand out your search, that there are other venues that have testing. He did say that they are considering adding perhaps perhaps the booster requirement for something like safe travels, but that would take, if they make that decision, it would take at least another 2 weeks to implement because they need to give people adequate notice to get that booster. So changes like that could take some time. And Ryan, sounds like they've been having a hard time purchasing tests that they actually want to purchase.
Yeah, talking about the challenges that presents with making bids and going up against, as he said, the federal government that is also trying to get more tests available, as well as other states and municipalities that are also really trying to use tests, of course, as a way to continue on with operations in a significant amount of areas. The governor also saying that he is ready to step back in if need be. He will continue to watch these numbers, especially with hospitalizations. He didn't necessarily give an exact number of when that would be to a level where he would need to step in to issue some sort of statewide mandate once again, but knowing that he recognizes that that is something that is a concern of people. In the past, we've heard him say when the hospitals have tents that have been set up outside, that's when you know that things aren't looking so good. And so when the tents come down, he would say that the restrictions would come down. Well, the tents at Queens Medical Center has gone up. And so we'll continue to pay attention to what the governor is using as his metrics to decide whether or not he will step back in and take control over what was previously given to the county mayors to make decisions.
Right. He did also offer some assurances saying that oxygen availability is widespread, that COVID patients, not necessarily hospitalized, but in ICU beds, are still relatively low. And so that was a comfort as well. But it does sound like there's a lot of decision making still at play, that he hasn't made any definitive choices in terms of, we always ask him for a line in the sand. And this is obviously a very tricky situation with a lot of different metrics that he's looking at, a lot of conversations happening. Also talking about the rainy day fund and saying, that the federal government, unlike in the last few years, is not going to come to the state's rescue, that money is basically tapped out. And that's why he feels it's appropriate to put almost $1 billion in the rainy day fund. We do expect a pretty robust fight at this coming legislative session.
Yeah, arguing that really that reserve needs to be filled back up, and that there is a need for it moving forward, and it would really be an investment in the future of what could happen should the state run into an emergency where they need that money. We'll see what happens. Things will unfold as he delivers his State of the State address again for the final time, as his term will wrap up at the end of this year. The governor, of course, will have to work with the legislature to move some things through. We'll see how things get. We know that there may be a bill that may limit any future governor's orders to issue emergency proclamations. So a lot to look forward to in terms of the legislative side and how the administration and the legislative body will work together moving forward into this next year.
That's right. We appreciate all of you being here. We know that you had a lot of questions. We do our best to sum them up. Coming up on Wednesday this week, we have a candidate for Lieutenant Governor, Jill Takuda. She'll be joining us, telling us about why she's seeking that office. And then Colin Moore, political analyst and UH Manoa professor, will sum up that race and give us an outlook on how that race and other political news is all shaping up. So we hope you join us right back here on Wednesday at 10:30.
Aloha. We'll see you then.
This episode of Spotlight Hawaii is brought to you by Long's Drugs and Beachside Roofing.